Hello and welcome to another robotics class. Today's class will be fascinating and will focus on advanced robotics. Yes, surgical robots are involved. Surgical robots are evolving away from typical master-slave robots and toward tiny devices for screening and basic surgical procedures. Capsule endoscopy, for example, has been performed successfully over the world for the past 5 years. Capsule movement has been researched utilizing legged capsules and capsules propelled by external magnetic fields to improve the dexterity of commercial endoscopic capsules. The potential for endoscopic capsules with miniature arms to be used in biopsy has also been examined. New surgical procedures such as natural orifice transluminal endoscopic surgery and single-port access surgery are also speeding up the development of revolutionary endoscopic instruments. These innovative surgical gadgets have the potential to advance the field of minimally invasive and endoluminal surgery in the future. However, due to space limits, the functions that may be implemented in such devices are usually limited. Furthermore, sophisticated capsules or endoscopes with miniaturized arms have limited dexterity due to the small diameter of such arms, a few millimeters, which results in a small force being created at the tip. Based on the aforementioned motives, a modular surgical robotic system known as the RS assembling reconfigurable endoluminal surgical system has been proposed. To overcome the inherent limits of single capsule or endoscopic devices, the RS system is designed for screening and interventions in the gastrointestinal GI tracts. Miniaturized robotic modules are eaten and assembled in the stomach cavity in the proposed system. After that, the built robot can modify its configuration to suit the intended area and task. Modular surgical robots are intriguing because they have the potential to be used as both self-configurable modular robots and revolutionary surgical robots. Many self-reconfigurable modular robots have been studied around the world in the hopes of building systems that are both reliable and adaptable to the working environment. Because the majority of these robots are intended for autonomous exploration or surveillance in unstructured areas, there are no tight limitations on the number of modules, modular size, or working space. Because the RS is designed for specialized uses and is employed in the GI tract, it raises a number of difficulties that have not been thoroughly examined in the modular robotic sector. One of the most difficult aims is to reduce modular miniaturization to a size that can be consumed. In addition, a new interface must be created so that surgeons may operate the modular surgical robot naturally. We can explain the benefits of the modular approach in surgical applications and show proof of concept for modular robotic surgical systems, including the design of the RS system, in this study. We might start by looking at the modular surgical system's design. The first section discusses clinical indications and procedures that may be used. The RS system's clinical aim is the entire GI tract, including the esophagus, stomach, small intestine, and colon. Biopsy for early cancer detection in the upper side of the stomach was chosen as the surgical task to be focused on as a first step among GI tract disorders that can benefit from modular robotic features. According to the World Health Organization, stomach cancer is the second biggest cause of cancer-related deaths globally, with stomach cancer developing on the upper side of the stomach having the lowest 5-year survival rate. As a result, using an advanced endoluminal technology to diagnose cancer early may result in a better prognosis. When dilated, the stomach has a vast volume of roughly 1,400 milliliters, which allows working area to assemble the ingested robotic modules and reconfigure the topology of the completed robot inside. Each robotic module must be tiny enough to be ingested and transit through the entire gastrointestinal tract. Because the size of commercial endoscopic capsules, which are 11 mm in diameter and 26 mm in length, has been proved to be suitable for the majority of patients as an ingestible device, each module must be downsized to this size before being used in clinical instances. Let's take a look at the surgical procedures that have been proposed for the RS system. First one is the patient drinks a liquid to distend the stomach to a volume of roughly 1,400 milliliters before to the surgical procedure. The patient next consumes 10 to 15 robotic modules, which finish the assembling process, before the liquid drains spontaneously from the stomach after 10 to 20 minutes. The amount of module swallowed is established in advance based on the pre-diagnosis and is dependent on the target tasks. Because the possibility of magnetic self-assembly in liquid using permanent magnets has already been shown, it was adopted for this research. Soon after assembly, the robot uses repetitive docking and undocking of the modules to arrange its topology according to preoperative plans. The robotic modules are controlled by a master device handled by the surgeon via wireless bidirectional connection, and the progress of the procedure is monitored using intraoperative imaging instruments such as fluoroscopy and cameras positioned on the modules. After the surgical tasks are completed, the robot either reconfigures itself into a snake-like shape to pass through the pyloric sphincter and travel to examine the small intestine and colon, or it completely disassembles itself into individual modules to be brought out without the need for external assistance. After the operation is completed, one of the modules can remove a biopsy tissue sample from the body for a comprehensive inspection. Let's have a look at the benefits of a modular approach in surgical applications. The modular method has the potential to offer numerous benefits in surgical applications. Depending on the location of the disease and the size of the body cavity in which the modular surgical robot is deployed, the topology of the modular surgical robot can be modified for each patient. Based on the necessary diagnosis and surgical procedure, a set of functional modules such as cameras, needles, and forceps can be selected for each patient. The modular technique allows additional components to be delivered inside a bodily cavity with a small entrance-exit hole. The modular method would enhance therapy in such difficult-to-reach regions as the human body has many cavities. Because numerous functional modules can be operated at the same time, the modular robot can execute tasks that a single endoscopic capsule or endoscopic device cannot. When more than 2 camera modules are used, for example, the surgeon can perform duties while viewing the site from various angles. Surgical instruments with a somewhat large diameter can be introduced into the human cavity. Endoluminal surgery has traditionally been performed using small surgical forceps that can pass via a few millimeter endoscopic channel. Surgical equipment with the same diameter as an endoscope, on the other hand, can be employed in the modular surgical system. As a result, the force generated at the device's tip would be considerable, and the functional device's performance would be excellent. The surgical system is more adaptable to its surroundings and resistant to failures. As a result, the surgical robot does not need to be equipped with all modules that may be required in the body because surgeons can choose whether or not to add modules with different functionality even during the surgical procedure. If the modules are not required in the following operations, they can be disconnected and discarded after use. In the same way, if a module fails, it can be readily replaced with a new one. As these benefits suggest, a modular surgical robot would be capable of completing tasks that are currently impossible to accomplish with present endoluminal surgical technologies. These benefits apply to modular robots that operate in any body cavity with a narrow entry and exit. Furthermore, this strategy could be used in natural orifice transluminal endoscopic surgery or single-port access surgery, both of which need surgical equipment to enter the abdominal cavity through a small incision. We've looked at how surgical robotics can be designed so far. In future classes, we'll look at how to prototype using experimental data from current research. Stay tuned for more fascinating automation case studies. Bye.